Good afternoon. This is Media Center, Ukraine, Odessa, and we are starting today with the discussion of the catch-up campaign for vaccination of children against measles in Odessa Oblast. Our speakers are Serhiy Dementev, the Deputy Director of the Odesa Regional CDC of the Ministry of Health of Ukraine, Oksana Sorochan, the Deputy Head of the Healthcare Department of the Odessa Military Administration, and Lyudmyla Samoilenko, and the Head of the Immunologist Department of the Odesa Regional CDC. Would like to start with Oksana. The catch-up campaign started on the 17th of July. What is the results as of today? Good afternoon, dear viewers, dear guests in this studio. The national catch-up campaign for vaccination of children against measles is ongoing for those children who have not been vaccinated as planned. And here we're speaking about the covering several diseases, including measles. The decision of the State Commission on Emergency Situations and then following the order of the Ministry of Health and our regional level following the order of the head of the Odessa Military Regional Administration, Mr. Keeper, the strategy has been approved for a catch-up campaign for children. And the planned vaccination, these are the children that should be vaccinated at 1 and 6 years. So we have selected the groups of children from 2 to 17. This is more than 230,000 people in the Odessa region. We have defined the target group, and I would like to thank the family doctors, the mobile brigades working 24/7, those parents who referred to their family doctors. Together, we were able to achieve significant results, and we are on the second in Ukraine. This is quite a significant result because for a long period of time we had been occupying the last positions. How many vaccinations have been made? And the colleagues will provide more details. And today we are talking about our plans and the implementation of the project for the future. Taken into consideration that we have just a forecast of the possible breakup of the disease, and we just understood that we need to increase the coverage for preventive vaccination for up to 95%. And this will create a passive collective immunity. And 5% of children who cannot be vaccinated because of their individual specifics and peculiarities will get the collective immunity. Measles is a rather contagious disease. If you have contacted child with the disease, you are 100% sure to get ill as well if you have not been vaccinated before. And there could be complications, severe complications in children, including severe pneumonias. There is no specific treatment against measles. We can treat only accompanying clinical manifestations of these disease in children and adults. So the only way to protect both children and adults is to vaccinate them, which is safe at the moment, and it is could be found at all primary medical care centers and at all vaccination points. And the issue of vaccination is the issue of the state safety. And it has been approved at the state level according to the national calendar of the preventive vaccination. We have vaccinations against hepatitis B, measles, rubella, tuberculosis, and etc. And this means that we can fully protect our children population from severe infections having negative consequences for the health of the population in general. To get vaccination, you just need to refer to your family doctor and to look through the medical form 62. And you will be able to receive information about vaccination. You can refer to your family doctor, and after the examination, a child will be vaccinated, and it will be free of charge. You've mentioned that the Odesa region is now among the leaders with regard to the amount of vaccination in the framework of catch-up campaign. Does it mean that you failed the previous campaign? No, it only means that we have identified the maximum contingent that has not been vaccinated. And after the full-scale invasion, we've received a great number of IDPs in the Odesa region who decided to stay here or who are in transit here. So among that population, we have identified children who were not being vaccinated on time. And we did everything possible to prevent the development of the infection among population. And we have experience of such cases in the past, and it is very difficult to fight such a highly contagious infection because it leads to a big number of patients with severe accompanying disease. And we are in the conditions of the full-scale invasion, so we need to at least prevent the possible breakouts of the disease to avoid the severe consequences of children and adults. So adults should take care about their health, to refer to their family doctors if it is possible to prevent outbreak through vaccination. Please do this, and you will be able to protect yourself, your close ones, and it will allow us to work in the ordinary mode. You mentioned that there are no that you've forgotten to mention one of the biggest problems, that parents are against of having their children vaccinated, and I think that this is the failure of information campaign. We have a certain percentage of refusals. Some of them are related to medical health indication, because children could have allergies, and it could have quite an acute response. Other responses related to religions, related to mistrust, etc. But I'd like to say that when in the past we had outbreaks of measles, we saw that if there is an outbreak in one group of population, and when parents see how ill could other children become, they just referred to us, asking us to vaccinate their children. And back then, we faced the problem that the burden on the healthcare area was too large, and we had to increase the amount of vaccines because we had unplanned group of people, of children to be vaccinated. So when we work targetedly with the groups, with religious organizations, with the parents who refuse, when we work individually with priests, we can see a significant increase in the vaccination rate in the groups. And if priests just agree to be vaccinated, then they are followed by the whole community. So this is the catch-up campaign, and then we'll continue to work with the groups where we have a lot of refusals, but we should make our people and children vaccinated. I have a question to Lyudmyla now. Oksana Sorochan says that it is important to be vaccinated. Lyudmyla, what could be complications we could face after vaccination? Good afternoon. So vaccination is rather safe so far. There could be complications, but this is not actually complications. These are unfavorable events after vaccination. These are the states that could be expected after vaccination. This is expected These are expected states because vaccines they trigger immunal mechanisms in the body, and after measles there could be a fever, but this is because the virus in the vaccine is alive, and the fever could be monitored from the 4th to the 20th day after vaccination. But the percentage of children with the increased temperature is not that big. It's 20–30%, and this is not a big number compared to other vaccines, where that could reach up to 45%. And here the percentage is not that high comparing, for example, to whooping cough. And a widespread response could be pain and some swelling in the place of vaccination. The vaccination started in the 1950s. We have accumulated quite significant experience, and that's why people should not expect any other unfavorable consequences after vaccination. We can say that this is safe, and the fever is a response to any type of virus, and pain, swelling at the point of vaccination is the standard response to any type of vaccination. Serhiy, Lyudmyla has mentioned that the vaccination started in the 1950s. Could you just share details about how the quality and level of vaccination has improved over the years? The vaccination provided to the Odesa region had been provided with the support of the international partners and the Ministry of Health. It is produced by the Netherlands. This is a quality certified vaccine that has been used all over the world for more than 50 years now. And the quality is proved with time. We have enough reserves of this vaccine in our region for the catch-up campaign, and also to implement our plans for vaccination according to the national calendar. As for the amount of doses, in the mid of July, we received more than 36,000 doses. In September, we received additional 8,000 doses from the Ministry of Health. And the vaccine has been supplied to all healthcare institutions involved in vaccination campaign and in preventive vaccination. And we can say that with the support of the Ministry of Health in the Odesa region, during the catch-up campaign, we have created a very powerful network of cooling equipment. We have received 3 refrigerating rooms, and we have also received several cars. One of them is a refrigerator car, for us to be able to supply vaccines to the remote areas. We have also received 4 vaccination buses that are also involved in the vaccination campaign. Moreover, on the territory of the Odesa region, we have 2 joint points with UNICEF in Odesa, 38A Bocharova and 24 Zhukovskого Street. And during the catch-up campaign, 920 children have been vaccinated there. And additionally, we have vaccination brigade, and we have 5 such brigades in the city of Odesa. And over the period, around 900 children have been vaccinated by these mobile brigades. Moreover, we have been using a very powerful potential of the Department of Science and Education when it comes to organizing catch-up campaign in the healthcare institutions. And this is the awareness-raising campaign among parents, involvement of parents to different meetings. And the aim is to simplify access to the vaccination procedure. The general amount of children that have been vaccinated since the 17th of July, this is 18,700 children, and you've received 44,000 doses. 36,000 plus additional 8,000 doses that we received in September. How long can you store it? Usually it can be stored for 2 years, and this vaccine is also used for planned vaccination, as had been mentioned by Oksana. And the children have to be vaccinated against measles at 1 and 6 years old. So we use this vaccine not only for the catch-up campaign, but also for the planned vaccination at 1 and at 6. What are the counterindications? There is a small percentage. These are children who in their history have severe allergy response to the first dose of this vaccine or to the components of the vaccine. But I'd like to say that one of the counterindications is allergy to the egg protein, but this is not true because there is a small percentage of this protein in the vaccine. That's why this vaccine is fully safe for children with such allergy. And there is one constant, so to say, counterindication. This is a severe allergy for the previous vaccination or the vaccine elements. They are temporary counterindications because, for example, those children with immunosuppressive therapy suppressing their immune system, they are also should not be vaccinated. Children with the inborn problems with their immune system should not also be vaccinated with the live vaccine. So children with the immunosuppressive state as a result of the immunosuppressive medication after transplantation, as well as the result of intake of the immunosuppressive medication. Children having certain disorders with their immune systems and should not be vaccinated, and also pregnant women should not be vaccinated as well. Other counterindications are only temporary, so if children get ill and have fever, 38 plus, but after recovery they can be vaccinated almost at once. And just if parents refuse to have their children vaccinated, what can be consequences from the legal point of view? or just generally for their children. If a child gets ill, then there could be different stages of severity for the measles. If it is a light stage, then there would be no severe complications, but there could be another severe consequence. This is panencephalitis that could develop in brain even in 20 years after this illness. It is not cured, it cannot be treated, and it can lead to invalidity or lethal cases, even if it was a light form. But if a child has other forms, more severe forms of the measles, then it would be lead to viral bacterial pneumonia that is very difficult to treat. This could be otitis. And it could be also the inflammation of the brain. It could be encephalitis or meningoencephalitis if there is additional bacterial infection. Serhiy, Lyudmyla has mentioned some different consequences. What else could you mention? And this is a highly contagious disease that quickly develops in collectives of people and groups of people, especially if children have not been vaccinated. And among 10 contacts, 9 will for sure have measles. And we have such an experience in 2017, 2018, when on the territory of the Odesa region there was yet another outbreak of the measles. And we know quite well that these outbreaks are cyclic, and they are registered every 3-4 years. That's why the Ministry of Health of Ukraine this year decided to initiate and organize the catch-up campaign. Because in recent years, we have not achieved our plan, 95% of vaccinated children. And last year, this indicator was at the level of 67%. And when it comes to the Odesa region, it was 64, 65%. And that's why we have rather weak children with the immunity to this disease, and we are not protected from the outbreak in organized closed group. And around 5,000 children with measles were registered. Last time there were 6 lethal cases because of the complications followed the measles. That's why it is a very dangerous disease. And at the moment, we have tools to prevent it through vaccination. Have you seen lethal cases after vaccination? No, we don't have such data. And I would also like to add that if there is a contact with the patient with the measles and there is the unvaccinated child or an adult, there is the emergency vaccination of the measles during first 3 days after the contact. And this is the world practice. It is an evidenced practice. And if a child or an adult is vaccinated on time, then it is effective. And if we have an outbreak, people should remember about this, that even if you have not been vaccinated before, you can be vaccinated during the first 3 days after the contact with a patient with the measles. So what is the situation with the COVID? And I would like just to add a few words. I fully agree with Lyudmyla. we are talking about protection. And we're talking about the protection of children and adults. And somehow we neglect vaccination. And we have been working with these vaccines for quite a long period of time, for many years. We have all the proving documents. We have the calendar of vaccines, and we do use vaccines that are used all over the world. And we say that we have tools to protect our children, to protect adults, but somehow we found numerous reasons what not to do that. And you've mentioned about lethal cases as the result of the vaccination. We don't have such information. And I would like to say that there are no lethal cases because this vaccine has been proved to be safe. But we've seen lethal cases in children after the measles. And vaccinated bodies, organisms are well prepared. They're antibodies that can protect children. And a child can be protected, not for 100%, but children have enough antibodies. That's why when there is a possible contact with infections, there is 20% probability that children could get ill, but that will be a very light form of this disease. As of today, both healthcare workers and the Department of Health, the CDC, all of them say that it is easier to prevent than to fight the disease, find these consequences, and a lot of there are quite often children who get to hospitals with the measles, and they don't have enough force to fight with other diseases after the measles, and they can get some other infections. How many children have died of measles on the territory of the Odesa region? 6 children. That was in 2017, 2018, during the previous outbreak. We are not talking about this year. We are talking about the lethal cases and the measles is highly contagious disease, and with the contact with the patient with the measles, they are 100% sure to also get measles. And then if there is outbreak, then we have a big number of patients. And the outbreaks that we saw in 2017, 2018 are still remembered by doctors because we had actually to treat people in hospitals in military units, because the first outbreak was in the military unit and we had to close it even. And everyone could find the reason why not to be vaccinated. But we have now an ordinary way to protect ourselves. We have safe vaccine. And I would like to refer to the Department of Health, all people on behalf of the Department of Health, to refer to your family doctors to have your children vaccinated. And there are changes now of the climate conditions. There is transition from summer to autumn, from autumn to winter, and we can see seasonal infections like flu, acute respiratory viral infections, and others. And there is the flu vaccine as well. What is the situation with the flu and acute respiratory viral infections? And we can see now the seasonal number. So we have not reached the critical threshold. So we can see the planned amount of patients. More than 72 patients with acute respiratory viral infection in inpatient care. So we cannot see any critical situation now when it comes to acute respiratory viral infection and flu. And what about the COVID? if there is an outbreak, we can see COVID in the population of the Odesa region among adults and children, but this is less than last year. And these are seasonal elements, and we can see we don't see any significant changes compared to the previous season. So we can see like the planned number, the expected number of people, and the small question about the measles. Should adults be vaccinated? They can be vaccinated, but they should pay for vaccine. Only children vaccination are covered by the state, and adults can get free vaccine only in case of contact with the patient with the measles. But if you don't remember if you have been vaccinated, or if you know that you have not been vaccinated, you can buy vaccine. That is the Belgium vaccine. It is there. I don't remember that this amount is not that big, and this is not 50 or 100 hryvnias. But if you just calculate the expenditures for treatment, then this amount is not that big. It will be less in several times than treatment. Around 1,000 hryvnias, right? Yes, around 1,000 hryvnias, 700, 800, and that just changes. But when it comes to the flu vaccine is not guaranteed by the state, but this vaccine can be bought in the drugstores, and I also checked it. It's vaccine grippe of the French origin, 400, 500 hryvnias. This is the price for one dose. And when it comes to treatment of flu, if I remember correctly, then antiviral, anti-flu medications are much more expensive. Thank you very much for joining us today, and I would like to remember that we discussed the results of the catch-up campaign for vaccination against the measles, and will continue at noon. Thank you.